For our next segment, and now we have someone, well, I can't wait to have this conversation. Dr. Dorothy Jeff-Nnamani. She's the MD CEO of Novo Health Africa Limited, committed to creating value through excellent coordination and also efficient delivery of healthcare services. Better client experience during hospital visits, enhanced client engagements in their own healthcare, reduction in medical errors, and improved clinical outcomes. She'll be talking to us about the importance of having a good HMO provider for your family in Nigeria. Good to have you here.
Thank you.
You have no idea. I've got so much I want to let off my chest. But
yeah, I hope I can help.
you definitely can, actually. We're talking about the importance of having an HMO for your family and for yourself. Nigerians always have Jesus. That's a big problem. So first off, I would like you to highlight to us what the importance of having an HMO is before we go into the nitty-gritty.
All right, so I figure that if you already have a HMO, it means that you're already budgeting for your health. You already created some allowance to take care of your health needs. And with that, you already have a health financing plan. So if you have a HMO, it could be that you have the health insurance under managed care, which is, it gives you the most leeway, and you have little risk to take on. So the HMO and the providers take up the risk for you. Or you have the third-party administration. In this case, the HMO does all the administrative management. However, they protect you from unexpected financial risk. Or you have the indemnity insurance, whereby you have a global amount that you already pre-planned to spend on your health. So either way, you have a health budget. So in looking at the importance, I like to categorize it in 5 ways so that people really understand. Because once you say HMO, they think it's just all about paying money. There are a lot of things that HMOs will do for you. First is the financial angle, of course. So if you have a HMO, you already budgeted for your health. So budgeting for your health means that you even have a better health-seeking behavior. You're not afraid to go to the hospital. You're not afraid of what they're going to charge you. You quickly, when you feel the need, go to the hospital. And it takes care of not just the expense on treatment. It also takes care of your additional other added expenses like feeding, if you're on admission, admission costs, diagnostics, and the rest of them, even rehabilitative in case you need some rehabilitation. And in some countries, you even have an incentive. Somewhere like India, you have an incentive. Your income, your tax, income tax is actually reduced. Yes, you have an incentive reduced, and the premium is also reduced if you're buying as a family. Then the next one, the other 2 angles I also look at it from is from the social, cultural, and economic angle. And this for me is very important because it also tells on the vision of Novo Health Africa. Our vision is towards individual, family, and community health for social development and economic growth in the Africa region. So these 2 other angles, I really want people to understand that HMO plans, you having a health insurance, is a social development tool. We have a culture of family. We're family-oriented people here in Nigeria, and I'm sure the rest of Africa too. And for us, family is not just you and your immediate family. It's all about the extended family. And extended family, so I like to say loved ones and family. So extended family is everybody around you, whether it's your community or you have like old boys, old girls, you have WhatsApp groups where you belong, and your tribe in general.
So how have you, or what work is on ground to make people more aware of how important it is to have HMOs? Because when you tell an average person about HMOs, like, do I have that money to go and just give somebody, not considering that they would need it eventually?
They will need it.
What measures are in place to make people more aware of the need?
Like I'm talking to you. It's that's the awareness. And then for people who are already registered, who have felt the advantage, they benefited from it, so they go ahead and tell other people.
Word of mouth.
Exactly, word of mouth. So the point is, Nigerians think that HMOs are for when you're sick. The plan is not just for when you're sick. It's a pre-planned thing. You have to plan for it. And if you plan for it, you get the best of it because there's health promotion. HMO will keep you healthy, apart from the financial
Do they keep
aspect.
everybody healthy? Because I know that for older folk, it's difficult for them to actually get HMOs to be their partners. So how is that? Is that a thing? Am I correct or am I wrong?
Well, I wouldn't want to say you're wrong, but yeah, because it depends on the plan on the HMO. That as a HMO, you have private plans, so you can actually design and create plans to suit a target population, and that is also another advantage of having a HMO plan because it covers for various lifestyles. So in a plan, you have something that is for the young adults, for the aged. And some HMOs like Novo Health Africa, we have geriatric plans which cover from 60 to 80 years.
Is it more expensive though than for a young strapping man like myself?
I wouldn't say expensive, but it's priced right.
It's priced right.
It's priced right.
And
because
do they
that's what
take
it's
into
all about,
consideration ailments that they might already have, or because some HMOs actually run away from these aged ones who have prevailing ailments. That's the sad part.
I wouldn't say that they run.
I wouldn't tell you they're running away, but they're like,
I wouldn't say they run away, but they haven't underwritten it. I think I'll use that word.
Okay.
Because it's you have to think through it and underwrite it. Remember, the person has to be covered for whatever you have already promised to be covered. So I would say they haven't really thought through it. Okay. But we in Novo Health, we've thought through it. So we offer the geriatric plan. We also have plans for young adults. Between 18 to 30 years. We call it the Discover Plan.
So I'm not in that plan because
you're not in that plan. At that time, you're discovering your health. These are the people who feel invincible.
Exactly,
These are the people
very true.
who don't like to go to the
They
hospital.
will never die, according to them.
Exactly. So you have to think through, what am I going to offer them? They're the people who want to have everything done on their phone. They don't want to go to hospital. They rather speak to somebody. Their interest is in, maybe they're thinking of changing their career. They want to talk to a life coach. They want to talk to a psychotherapist.
Mental health.
That's what
That's very interesting. I never knew that
they want to talk about their dental care, eye, the lens, and all of that.
Wow.
They don't want to sit down in a hospital and be talking to any doctor.
We don't have so much time, but if you were going to give one advice to people out there, especially on this endeavor to try and make aware the importance of healthcare, what would that be? What would you be telling them? What would you?
I'll tell everyone to go get a HMO plan because it helps you through your health journey in life. It ensures that you have better outcomes when you go to the hospital, and it reflects on your quality of life, and it also reflects on the length of years. So you talk about your life expectancy.
Yeah.
And
quality of life, very important.
And you better understand what it means to be engaged in your own health. Yeah.
Well, thank you very much, Ms. Nnamani. Very good to have you here. Never been put like that. And of course, I'm going to definitely be asking some more questions behind the scenes from you.